You go through residency, and residency being 5 years, you're learning orthopedic surgery, and now I'm kind of going into a deep dive into adult reconstruction or joint replacements. You get to see how the expert does it, and then them kind of tweak the things that you're doing, not necessarily throwing everything out the window, but really working towards you perfecting your own technique too. So I came and interviewed, and I love that every question that I asked was very straightforward. I got direct answers. I'm not a huge research guy, and Dr. Morrey said, you can do research if you want, you don't have to. And the autonomy is there, and it's a graduated autonomy. So it's not just a fly by the seat of your pants, it's actually, you're being taught specific things, and the more you demonstrate what you're doing, and you get to do more and more and more. So I think that that's probably the best teaching model. And then obviously the people that you're learning from are people on the back of textbooks. Like literally one of the books that they give you in the very beginning says Morrey and Morrey on the surgical approaches. So the clout behind the name of your mentors is pretty important. And obviously in the fellowship, whenever you finish, these are your mentors. These are the people, that relationship is very, very, very personable. I can call Dr. Morrey or Dr. DeLee 24/7, and I always have that backup. You finish residency and you're gung-ho, you're ready to go, and now you sign up for another year as a fellowship. The last thing you want that year to be is another year of residency, which it is not. You're treated as another attending surgeon, from taking call to timing out surgeries to in the operating room. It is all geared on you doing the surgery. And Dr. Morrey will be the first to tell you, I'm here to hold sticks or to basically hold retractors. You're doing the case. And that started literally day one. As a resident, you're doing a lot of the surgery too, but there's that autonomy of you're making every single decision. You're doing every single step. For example, in my residency, doing a total hip replacement, you would do everything, but a lot of times you would not get to do the reaming of the acetabulum. I reamed an acetabulum day one in this fellowship. And our entire process is fluid. It's a conversation, and then we make it happen. We already have an upcoming dinner talking about the finances and early financial decisions, from investing to the entire thing, coming up here in the next couple weeks. So it's fluid. That's an exciting part of it. The fellowship's really whatever you want to make it. And that's pretty unique out of the whole fellowship process.